Welcome. Can you hear me? Perfect. We'll get started in just one moment. Welcome.
Hi, how are you going?
Good, thank you. How are you? Perfect. We will get started. I'm just going to do a quick 30-second introduction. So thank you so much for joining us. We're here with Griffith University's Dr. Mohit Tolani. He's a Griffith Dentistry alumnus and former Outstanding Alumnus of the Year. So looking forward to hearing your presentation tonight. If anybody does have any questions, please pop them in the chat. If we have time, I will go through them at the end. But otherwise, you'll see my face pop up on the screen when we have a couple minutes left, but otherwise, take it away.
Perfect. Let me just share my screen. Just bear with me. Just bear with me. Just bear with me. Okay. Great. So can you all see my screen?
Yep, we can see your screen.
Fantastic. Okay. So the presentation I'm going to talk about is my journey into dentistry and dental school, especially with respect to why I pursued dentistry and why Griffith University and what I gained out of it and where I'm now. So I'm going to put forward the other slide. So I came from Sydney. I chose the Gold Coast because I did my high schooling over there as well. And I thought it's good to actually get a different taste and more away from home and obviously put myself into the deeper end and do dentistry. Why dentistry? Because I think it's an amalgamation of handwork, artwork, communication, health. So I thought it was perfect blend for me because I identified my strengths and I thought, well, this career is perfect because I can see my treatment from A to Z and make people smile and let them leave with a good smile. At the same time, there's job security and I can then choose as well when I get a career as a dentist, which I've got now, the working hours, going to the private sector, the public sector, or a combination of both. So that's why dentistry was the perfect choice for me. In terms of Griffith University, I thought it's a new university, new dental school, which was opened in 2004 in terms of the dental aspect. And it's amazing because they've got new technology, international research expertise. At the same time, you've got professors from different parts of the world sharing their expertise and knowledge. So that was fantastic. And I thought, well, it's got the newer technology, so that'll be good for me as a dentist because we need to be updated with technology, with all the materials, with all the products, with all the gadgets which we use in day-to-day basis. So that was fantastic. In terms of the university experience, the way I maximized it was connecting with previous alumni, speaking with lecturers, professors, and I'm still in touch with them. If I need any help, I'm like, hey, what do you think about this sort of aspect? So I think that's been very good because In-house, it was one-on-one mentoring, which I found was effective in the clinic, and also connecting with the various professors and lecturers in a social setting as well, where they made the formalized study environment slightly informal as well, which was actually good because there was no fear barrier. You could ask questions and they considered you part of the fraternity from the beginning, which is fantastic because you didn't feel that it's them versus you. So that was really, really good, which also led me to assist and observe various specialists and dentists in-house who were working in the university. So it gave you a first-hand experience as well. And it was fantastic because it was best of both public dental sector and private dental sector. So when I went on placement, it was public dentistry just on the Gold Coast, and private dental sector, which is Griffith University itself, where we had patients who were getting treatment. So you saw best of both the worlds, and there was opportunities to go on placement in rural and regional areas, which my friends did as well. So plenty of work and plenty of things to choose from. So the variety definitely intrigued me. The way I got involved in dental school was obviously through extracurriculars, academics, going on placement, networking, contact building, and finding a mentor. I think mentor is very important because if you have any questions or technical difficulties or whatever be it, the previous dentists, the clinicians who have been there, the supervisors who are there, all of them are there to help you out and guide you to the right path. At the same time, give you advice as to, hey, this will be good, that will be good. They make fantastic referees for your future. And I'm so lucky that I'm still in touch with my mentors from Griffith University through my clinic days. Some of them have translated to becoming my friends in real life as well. So I feel that because they've got first-hand experience, they can help guide you to various opportunities. I got involved with the National Australian Dental Student Association, where I became the president, and I led a student-led conference on the Gold Coast for the first time. And the university was very supportive of that extracurricular aspect. At the same time, I got involved with the Dental Protection Limited's Young Dentist Committee, and we organized, and I was part of the conference as well as a speaker. So that was fantastic. So the opportunities which came through dental school, during dental school, and after dental school were amazing. So I graduated with flying colors. As you can see, I'm throwing my graduation hat. One day it'll be you guys as well, if you guys choose dentistry. And I got acknowledged on my graduation as well for my achievements. But what now? Where do I head after graduation? Where do I go? What do I do? So there was always a confusion amongst a lot of students as to where do we go now? Do we go into public sector, private sector, corporate sector? Do we go into a different city? What do we do? The choice I made, this is me before and this is me after graduation, the choice I made was to go into Shepparton, a rural regional town in Victoria, in regional Victoria, which is 2 hours north of Melbourne, far away from the Gold Coast. I thought I'll challenge myself. I'll throw myself into the deeper end and explore my clinical skills, strengths, weaknesses, make mistakes. And there was a mentor there as well, a senior dentist who's been working there for 30 years, who was my guider. So he was looking after me. And then there was another person from Melbourne University as well. And that's where I started my career. Very eye-opening experience. So this is Victoria, the map of Victoria, as you can see. And Shepparton's right here, whereas Melbourne's here. So it's far away from the Gold Coast, if you know the map of Australia. So yeah. So the support was fantastic. We had an oral health therapist, we had plenty of nurses, and we also made it to the newspaper in terms of the work which we were doing in the hospital, in the public hospital, and that was fantastic. But a few things happened in the placement when I was based in Shepparton in my first job. You know that this is a healthy mouth. You can see that it's a beautiful smile. When you go into a rural regional area, what I found commonly was the fact that there was a lot of gum disease, a lot of decay, children who were losing a lot of teeth as well at an earlier age, which was kind of astonishing. There's a big discrepancy between rural and regional Australia in terms of dental health versus the urban city dental health. And you could see that quite obviously in Shepparton. There was other things which were happening. We could see a lot of abuse in terms of drugs. We could see high smoking rates, and that obviously caused gum disease. So I'm sorry these photos may scare you, but this was the reality which I was exposed to. So I was thrown to the deeper end and thrown with all the complications which you read in the textbook. You're seeing them firsthand in a rural regional setting. This is just an example X-ray of a person whom we had seen, a 17-year-old girl, Most of the teeth were decayed or broken down. If you had a look at the mouth, actually, the story was obviously unreal because it wasn't pleasant. We ended up taking out all her teeth, and these were, so at for a 17-year-old, all teeth gone because the hygiene was quite poor. No other health service was seeing her, so she was referred to our health service in the district. We did that under general anesthesia, and we gave her dentures at the age of 17. There was a 2-year-old girl for whom we removed the front teeth as well. That opened my eye to the fact that it's not just clinical dentistry that's important. We have to go to the crux of it. We have to actually take a stand and do something. So as part of the program at Goulburn Valley Health Hospital, where I was placed in Shepparton, we took our van. We had a dental van. We traveled miles for smiles, as you can see. We took it to various nursing homes, aged care centers, did dentistry for them, took it to different childcare centers as well. So there was a lot of oral health promotion and education. So education was lacking, dental health literacy was lacking, or at least it was minimal. People had access to dental care, but still there was obviously that gap of education. And I wanted to promote that education and get people aware that where is the best closest health service. So we started the Shep Health project in rural regional Victoria with an optometrist friend of mine and another healthcare practitioner. And we basically took the message out to the community, to young students and teachers, and spread the message across that dental health is important and what to do, how to identify what's wrong in your mouth and take the step. The charity project gained momentum and the resources are still used in Shepparton to this day. I got recognized for the achievement of the program in Shepparton as the Young Professional of the Year that year, and Griffith University recognized me as well with the alumnus of the Young Health Alumnus of the Year award in 2017. That obviously stimulated a confidence in me that what I was doing was right. The training that I got was fantastic, and my goals and aspirations got molded that way. So I mapped my future that way, mapped my smile that way. I moved to Sydney because my wife was expecting, so needed the family support, but I still wanted the regional touch. So even though I live in Sydney, I drive an hour and a half to Dapto, which is in Wollongong, which is south of Sydney. So in a regional setting, that's where I work in a private practice. But I wanted a private practice with my own flavor, because what I noticed here as well, that there's about 88,000 patients on New South Wales public dental wait list. That's quite a large number. 6,500 in my region itself. If you've got pain, think about the wait list. I mean, do you want to wait that long? I mean, who's going to see you? By then the tooth would have decayed and fallen out. So, and it's not just about your mouth, it's about your general health, psychologically, physically, mentally. So stats are alarming in terms of how many people are on the waiting list and how regional Australia dental health is compromised. So keeping that consideration in mind and working in a private practice, the practice where I work and myself, we brainstormed an idea and we started the Project Smile 2019 program, where we opened up the clinic doors for free checkups, free consultation, and we did pro bono free treatment for a selected group of people through this program. We had a lot of interest. It removed the fear barrier, it removed the cost barrier, it opened eyes of the community that dentists are not, like fear people or scary people. Like you can ask openly the question because everyone has the right to gain knowledge and receive knowledge. So we removed all of that through the pro bono project we did. I got involved with the advocacy aspect because we saw there was a big change in the community where I'm working in terms of the oral health education and dental health awareness, which was good. And students and children in childcare centers took note of that as well. And there's a photo here that I'm presenting at a local childcare center. So that was quite fantastic. We referred people to appropriate agencies for treatment if they were unaware of that, and that was quite good because the uptake of dental health was taken very, very nicely by the community. I then took another shot. I said, well, yes, there's people traveling distances to see me in Dapto in Wollongong area. They're traveling 2 hours, 3 hours to see me over here because I'm doing this project, which is fantastic. So I thought, well, I'm going to take a different shot. I contacted the Royal Flying Doctor Service. And then I said, can I volunteer with you as a dentist and explore a different opportunity? So through the Royal Flying Doctor Service Southern Eastern section, which goes around the state of New South Wales, I flew to Dubbo. From Dubbo, we flew to various regional towns where dental care was limited, or provision of dental care was limited. We went to regional correctional centers, prisons as well, where we ran the relief of pain clinic as well. And that was amazing. So the opportunity was fantastic and the acknowledgement was great. And I feel that the work was recognized at a national level, which made me quite proud and which got the issue of dental health and dental health literacy to the national forefront. At home, I mean, I do have a life. So I have a young 2.5-year-old son whom I play with as well. And I'm trying to get him into dental interest from the start. So he's aware of that as well. But keeping all these things in mind, for me, it's basically a message for you guys that if you are going and pursuing dentistry, it's not just mouth. There's more to the story. The opportunity is, there's a lot of opportunities out there, and the sky's the limit. Go explore it. Thank you.
Wow, thank you very much. That was incredible. It sounds like you've had an amazing journey and done so much for the world of dentistry. So thank you so much for sharing that. As I said, we don't have any questions that have popped up. I think everyone was kind of mesmerized by what you were talking about. So thank you so much. If you do have any questions, please head back to the Career Echo chat room. More than happy to answer any of your questions or anything like that. But if you do have any kind of final things to say, go for it. But thank you so very much on behalf of OzTREKK.
No, thank you. I feel that I'm passionate about what I do, and I feel that the university has been quite supportive because I engaged in dental health literacy projects when I was at university because they had a big focus on that. And students, when you're dental students, you do get the opportunity. So I feel that it gives you the scaffolding to obviously go launch yourself. And I launched myself in this trajectory that I balanced my career with flying doctor service, the practice I work in, and advocacy work, which I do with the Dental Association. So I feel that it's not just mouth, mouth, mouth. There's the whole body and there's the whole world, and I treat the population, not the person. So that's the idea.
Fantastic note to leave us off on. Thank you so much, and thank you so much for attending. Have a great rest of your night.
Thank you. Thank you.